So the next speaker is Dr. Esther Kruitwagen from the Netherlands, and she will speak about if the ALS care model as used in the Netherlands would be applicable to adult Duchenne care as well. So Esther, the floor is yours.
Thank you very much. I'm very happy to be here at the last moment. Okay, can I have the next slides? The next one, please. Also the next one. Yes, I will, because I only have 10 minutes, I will make a shorter one. I'm talking to you about ALS. I am a doctor specialized in taking care of adult patients with muscular disease, neuromuscular disease, among which Duchenne and ALS. I'm part of an expertise center, and that's why I did this project. Just to make sure for everyone, ALS completely diagnosed as a very progressive disease with a median survival of 3 years, an incidence of about 500 patients a year. And in the Netherlands, we have 1,500 ALS patients. There's no cure. And all we can do is very high level symptom management and focus on quality of life and participation. And in the right hand in the corner down, you see a map of the Netherlands. And thank you. And you see all the red dots. They're all specialized neuromuscular teams for adult patients with a neuromuscular disease. Next slide, please. Well, ALS is a diagnosis with a very diverse prognosis. It's a median of 3 years, but this is actually the actuality what we know from a recent research project by Westerling. You see that there's a group of patients who have a very short prognosis of only about a year, and patients like we have 10 years or more. And so we have from very short to very long. So in your patient population, you have a very big diversity of of your patients, and you have to adapt very well to their prognosis and their level of progression. Next slide, please. Okay, so you saw all these teams, these 34 teams in the Netherlands, and patients told us, this is actually an initiative of patients. They told us that they were very happy with the care we gave them. They were, that it was okay, but they said it's time to make it more personalized, especially in the way we organized it. And you can imagine when you have a diagnosis with a prognosis of about 3-4 years, you have other things on your mind. This man, for instance, he's a very active life. He has a career. And he said, well, that's the main thing for me. And the next slide, please. But at the same time, when you are an ALS care specialist, you are very busy. You're always monitoring, just to be proactive, to be sure that you give the right education at the right time. And in order to do that, you must know how your patient is functioning and how his spouse is functioning. So you need information. So the reflex always has been in ALS care to see these patients every 3 months, for instance, with a large team, just to be sure that you get all the data. And that's exactly what they said. It's very good care, but it's too busy. It's too many appointments, and it's not always the right information at the right time. You're too proactive. So what we did together with them, we developed a telemonitoring tool. Next slide, please. The next, yes. So this is that's what they asked, and they know because there was patients like me already, but that was a platform which patients filled in their data for years already. So it was already well known in the ALS community. And they asked for more personalized care in content and in timing. Next slide, please. So this is what we developed, a new tool called ALS Home Monitoring and Coaching. And it's actually a very simple app in which we ask patients to fill in some forms, so some questionnaires. One is the ALS FRS. It's a well-known questionnaire in the ALS care about physical functioning. You see weight, and you see a question about well-being on your left. And well-being is a simple question. How are you? Is there anything you want to mention? How are you doing today? And you can make differentiation in how frequently they do this. So very fast progressive patients can do this every day and wait every week, and the ALS FRS every month. And there's a chat function, very important. And we realized how important, because people really like to chat. They chat about little questions, about things they noticed in the newspaper or whatever, just, you know, and the way just to be able to communicate with the caregivers in a very easy way at home. So on your left, you see our patient, and on your right, you see our nurse practitioner or our specialized nurse. She is specialized in home monitoring and coaching, and she is working with me together. And she is on the phone or on the chat function. And she, in the next slide, what she does, she gives very personalized advice together with me. So we see the data every month, we see the data, or when something is wrong, when one of the, for instance, when someone is really dropping in weight, we get a signal. So we respond to the data we see or to the questions patients have. So it's never only watching little data, it's always also communicating with the patient. So we have continuous data, which is really nice, and more than I ever had. So when you had talking about personalized care, I'm able to really see the personalized spectrum of a patient in time. So I have much more information about his functioning. And with the multidisciplinary care team, we respond to the questions or to what is happening. And so we have a wonderful loop with continuous data and alerts and patients' messages. Next slide, please. And of course, we evaluated this a few times. We started at the end of 2017, first a pilot and then a larger group. And now 90% of my patients, and I have about 110 ALS patients, are in this app, which is really nice. And they're very, they're very happy with this. It's not, of course, they say it can be very, well, it can be a burden sometimes because you see your own functioning, but actually that gives them also a sense of control. And having a sense of control when you have a progressive disease is a very important fact. Everyone looks for having a sense of control despite the severe limitations. And they say things like, it's reassuring, it's wonderful, I know you're on the other end and I can talk to you, but I don't have to visit the hospital. It's personalized, and it also gives a sense of self-reflections to patients, which they themselves mention as being very important. We have a very high adherence rate of 87%, and adoption rate of 80%, which is really high. And all patients recommend it to others. And then we also evaluated us. That's the next slide. And for us, it's better timing of interventions and information. For instance, when someone doesn't have bulbar symptoms, why bother him with the possibility of having problems with swallowing or eating? Patients themselves prepare themselves better of a consultation. They know what's coming. And the efficiency of a visit to the clinic is better, is higher. And we get less burden because we were always, in ALS care, it's a well-known fact that the healthcare professionals are always alert whether they're not forgetting something in daily care. So now they have alert themselves in the care for patients. This is really nice. Next slide. Of course, we had a business case, which was, thank God it was positive, which means that it's worthwhile to go on. Well, I won't go on because I don't have much time, but that's really also a nice fact of this whole project. Next slide. So we have very useful longitudinal data also. It's also for research purposes, it's very interesting because now we have a combination of, in our case, the ALS neurobiology lab, the genetics, the medication trials, and our longitudinal data, which is very interesting for the future research. So we're now building a very nice registry for our patients. Next slide. And this is what it looks like more. It's grown even more. But this is very important, I think, when we're talking about good care and also future projects. It's wonderful that you can integrate daily care and longitudinal data and basic research. I think that's the future. We should more be aiming for that in every specialty we're doing. Next slide, yes. So it brings practitioners closer to patients, and that's strange because actually it's more personalized care with telemonitoring. It improves quality of care, and we have a source of research data, which is really nice. So next slide, please. Next slide, please. Duchenne care. I think, of course, we have patients with a less progressive course of disease. But also in Duchenne care, we need longitudinal data, especially also for rehabilitation medicine, for daily care. It's very important, like all the previous speaker told us, that it's really important to know your patients on a longitudinal basis, but also to have these data and to be able to know which aspects are important for quality of life and for participation. For instance, the already mentioned psychological factors. Duchenne patients my adult patients are fragile, have many appointments, and they mentioned also to me that they love tele communication because it's already one appointment less, and but they want to speak to me. So I also have a screen-to-screen contact with them. But I think disease management can be more proactive with more data, but maybe this is telemonitoring can be a way to solve this problem, that they don't have to come to the outpatient clinic that much. So I have a suggestion. Next slide, please. You could really easily start with, you should start easily when you start a project like this, with simple questions about well-being and a symptoms questionnaire, talking about all those frequently asked questions they often have and which you want to ask in the outpatient clinic, and just let them fill out these questionnaires. And a chat, because I think you will be surprised how often they will use the chat for small questions or, little marks, or and you could use a push message every 6 months. So you're sure that they respond every 6 months with a push message like, "Hi, it's time for your questionnaire again." I would love to have that in my outpatient clinic. Next slide. So that was it for me in a short time, 10 minutes. But I hope I have inspired you a little bit. And I think it is the future for our care. Thank you.